Magic 89.9.
HealthLine!
Well, what we had was really hot, so it is a hotline for HealthLine.
It's super hot, too, today. But anyway, welcome to the show. I'm Tina Ryan, along with Doc Rylan Flores, who just, again, treated us because we got lucky today.
I know, right?
Suking in the building, suking vendor of merienda.
Banana Q.
Banana Q,
And
turon, and kwek. Well, honestly, I did bring some snacks for the boys, but oh my gosh, I left. Doc.
Sugar Rush is still...
You want to play my voicemail?
Oh, yeah.
On the way here.
You know what?
I left Doc Rylan a voicemail. Oh my gosh.
I mean, you have to hear this, and my question is...
He totally called me back, guys.
What reaction would you have?
Play that. Let's do a little playback.
Well, hold on. Give me a sec.
Oh my gosh. Hey,
I'll put the volume up and try to listen to this.
Doc, parang ako nagkaroon ng chest pain. Bigla. Ang sakit. Hirap huminga, Doc. Kagaling ko lang sa gas station.
So, I didn't hear the gas station part. What I heard was chest pains, couldn't breathe. So I called up immediately. I go, what the heck's going on? And she
So
goes,
you kind of panicked na pala.
and I was on my way out.
Oh my
I just came from LaSalle Green Hills, and oh, by the way, congratulations to the boys there. They did a really good job.
Okay.
But I promised I'd greet them by 5 because they're still in class.
Oh, sige. Let's go back to that in a bit. But oh, wow. So you were really concerned when you called back.
I was concerned because heck, you don't receive calls like, I'm having chest pains and I couldn't breathe. I was gonna ask, are you with Crush?
First of all, earlier I was. He treated me to lunch. Well, no, but this was the first time in a long time yung talagang pikit mata, inabot ko yung bayad. Because on my way to... Okay.
Full tank ba yan?
Oh my gosh. My brand used car. Anyway.
Brand used, really?
Yeah. I mean, like, because last night, there was... You know what? There's a gas station in
there were lines
Rotonda. I'm not going to mention the name.
Stations. I mean, not just there, but...
everywhere nga.
Everywhere.
But surprisingly, sa sobrang dami ng nagpagas kagabi, nag-traffic sa Rotonda ng Mandaluyong. And so I tried to pass by another gas station. It's the same. So 4 gas stations that I passed by, there was a line. So I'm like, okay, you know what? I'm just going to do it tomorrow. Boom.
So I got kind of lucky last night.
I am going to kick you right now.
Because last night, I go, I still have gas. I usually get gas on the second line. I don't get it when it becomes when the light goes on, because that means you still have a line of a tank. But for me and my car, I usually the second line before that, because otherwise that small itty bitty car of mine is a gas guzzler.
I mean, don't get me wrong. I still had I was still up 2 lines.
So I was in the gasoline station, but everyone was facing towards me. So I was like, will I line up or not? I don't want to line up anymore. But for whatever it's worth, I went around. So there was just one car. So I had to wait a minute and a half.
Well, look at you. Look at you.
And I was going, everybody's lined up for a full tank. So I used to get full tank. I don't get full tank anyway.
I want to say, hi, baby B. Come here. Come give mom. Our social media girl. I call her. Bianca, thank you.
Hi, Bianca. Thank you for the posters again and the videos.
Live, by the way, on twitch.tv/magic899TV. Today is going to be a wonderful day because we have 2 wonderful guests. One's a dentist. Again, our urologist is back.
Coming back on time now.
Yes, so we're going to talk about pee and our teeth. Pee and oral health. Wow.
Oh.
Parang diba? Malapit sa isa't isa. So, while she's at it, why don't we let her say hi, Doc Tess?
She's here already.
Hey,
Doc Tessa Portillo-Sy. Hi,
Good
Doc Tess. Tignan mo naman, no?
Yes.
Yeah. Hi, Doc Tess. We're going to be talking to you in a bit. So,
I know. Thank you for having me.
Of course.
For those who have questions, the Viber line is also still open at, where's my Viber line? It's gone now.
What's your excuse?
Okay. I was able to read it a while ago.
We should have that memorized by now, though.
I know. Sarge is gonna kill me. But wait, I do have it. So our Viber line is at 0945-971-4011.
And of course, again, everyone on twitch.tv will say hi to you guys one by one. You're all amazing.
And now it comes back.
Thank you, Direk.
Direct talaga. Oh.
Yun ang nagagawa ng turon. Oo, diba? Let's get back to more of the music.
That's the increase of sugar, you
The
know.
latest from Bruno Mars this time, Doc Rylan. Oh, I just might.
know.
On today's best music.
Magic 89.9.
Magic 89.9.
3 in a row here on today's best music. Magic 89.9. This is HealthLine. Gangster Love Trueno. Before that was David Guetta featuring Nicki Minaj with Hey Mama. And we started the set with Bruno Mars. I just
Bruno
might.
Mars.
So this is HealthLine 327. Hi, I'm Tina Ryan.
Doc Rylan Flores here with you.
Sugar high once again.
All right. So I do hope that sugar rush, you know, like makes everybody else.
Well, makes me forget what I
keeps us
paid
in the
for.
background actually quite active enough for the driving that they have to do, especially those in traffic in the moment.
Wag na traffic. It reminds me of the gas prices, man.
I
It's
know,
sakit.
right?
And somebody actually said on Twitch, magbike na lang daw tayo.
Or the scooter ones, the true scooters, not the one you have to sit on, the one you have to stand on.
Oh yeah. I haven't tried one of those.
It
I
is.
know,
It is.
but I guess,
Afraid.
diba?
Those buses that just
I know. But
Take
one
the side
thing,
streets.
one thing that's gonna be certain, I do believe the car count in EDSA might actually decrease.
Well, when are they deciding, diba? Like there's a news that it's gonna be a 4-day work week.
everybody's
4-day work week. Well,
Has it been
for the
decided?
It is. It has.
everyone's buying electric cars, so
Yeah.
Okay. I
but there's
don't know.
no coding, so
No coding.
please.
And then
No
everybody's
coding.
stuck in traffic
Exactly.
because there's so many electric
Electric cars.
Exactly.
And then they're gonna be coding electric cars as well.
Oh my goodness.
So
Anyway,
that's
that
gonna
beautiful
happen.
voice, by the way, belongs to our very special guest. Joining us today is a proud alumna of Poveda who spent her 4th year of high school as a Rotary exchange student at Lincoln High School in Portland, Oregon. She
Nice.
studied biology at De La Salle University before earning her degree
Animal.
from CEU. Or as I call it, Centro Escolar College of Dentistry. Now she's a member of the Philippine Dental Association and the Pasig Pateros Taguig Dental Chapter. When she's not practicing dentistry, she loves the beach. As you can tell, her tan is just, hello, bongang bonga. Playing golf and watching tennis. I just love her
Sana
tan.
all.
Exactly. Ladies and gentlemen, first time on HealthLine and, second time in the Magic
And the
Magic
booth.
Studio.
The magic booth.
Magic booth. She was here promoting something back then.
Yeah,
So,
our 25th homecoming 15 years ago.
Doc Tessa Portillo-Sy, DMD.
Hello, good afternoon.
Hi, Doc Tess. Thank you so much for being here today.
No.
Ayan.
Thanks for having me.
Teka na, nakagat ko hindi.
Ano yan? Somebody's talking about you?
I wish. Oh my God, wait. Okay, here we
Can
go.
I help you?
I know.
Can I help
Oh
you?
my gosh. I mean, Doc, like seriously, my cure for canker sores.
Uh-huh.
Why is it only dentists are parang kayo lang
To
yung
dispense
Oo,
that?
the Bacterol. Why is that?
You know what? The Bacterol is just there's newer ones that are out
I was
now
about
because
to
it's
say,
from
there's newer
the
ones.
olden-
That's like an olden time.
Yes, the
cure.
color purple
Seriously.
one. And if you I mean the only people that should be dispensed in the clinic because it's very dangerous. If you put
That's
more,
true.
it can really
kasi,
burn.
Yeah. I mean, you.
It does. It is.
Okay. What, do you use that also for your carpentry, Doc? Hello? Di ba pang singaw lang yun? Okay, let's not go there. Okay. Here we go. First question.
Yes.
Because, I just want to say pala, Doc Tess here is with the very first, how do I say this? Filipino brand in a market dominated by international names, and that is TVP Dental B.
Yes.
Yan.
Dental B.
So, my first question is, what challenges did you face as a local entrepreneur in the oral care industry?
The biggest challenge was competing with the big multinational companies who obviously had the strong marketing and distribution. So, but TVP actually stands for my dad.
Yeah.
Initials, Tomas V. Portillo.
Oh,
but in the
wow.
beginning, he wanted it to be the very personalized toothbrush.
Nice.
Okay, so he was just so confident of the product because he used to be the country manager of one of the multinational toothbrush.
So competing.
He retired.
Before, yeah.
Yes.
Oo.
Yeah. He was the country manager. But since there was a merging of two big
that's
companies, so
why.
the president of obviously had to be the
One. They have to choose only one.
Correct.
And there should only be one.
But you know, Doc, the reason I really invited Doc Tess here is I hosted the, was it 40th, diba?
Yes.
The
Wow,
40th
40 years
anniversary
already.
of the company.
Nice.
And I was blown away by how the happiness
Oh, yeah.
of the employees. I mean, like,
Should have called me with you.
you know what? That was a weekend you were away.
Okay, fine.
Yeah, I know you do hostings as
Okay,
well,
fine.
but
Yes, I do.
nakakataba ng puso the way I felt the happiness
I
from
know.
the
Well,
employees.
The smiles that you see will actually fill you up.
family, because that's how my dad started as
That's
family.
so good. That's so
They're
good.
very
were-
hands-on as well. And my gosh, Doc, they have employees na tumagal na ng 35 years.
Wow.
What's the longest? The Ate Tess, 38?
30.
Yeah.
Wow, 38 years.
38
I mean,
years.
if you look at it this way, you were just mentioning a while ago that it was a battle between something local, something small, versus that of the multinationals.
Oh, yeah.
And you know, it's like a David and Goliath story.
Yeah.
And because it's now 40 years,
Yes.
obviously David won.
Ay, right. Oh my gosh.
Still here. Alive and kicking.
Designer
Congratulations on
Dad.
that.
Dito na naman si Designer Dad. At ako, eto, nasa gas station nga, naiiyak sa mahal. Ay, nagka-heart attack na ako dyan, Designer Dad.
Dapat ngayon merong sa gas stations, merong nakapost na nag-check ng blood pressure.
Right.
Para sigurado lang. I mean, will you get gas? Your BP's too high. No, don't get gas.
May nurse on standby. Mike says perfect timing. That happened to me sometimes as well, accidentally biting the tongue while talking. But you know, well, Ate Tess here, or Doc Tess here, is a dentist. So I am Negatron. What's the cause of singaw?
Sometimes, let's say, if you eat something hot, then it kind of, oops.
Stings you and everything
Stings you.
becomes thick and numb.
Yeah, or
already.
you accidentally bite your lip.
I was gonna say,
Another
when you eat
reason.
xiaolong bao immediately.
Oh my.
Another reason could be maybe it's time for an oral prophylaxis when there's like
Oh,
some
a whole lot
bacteria
of-
that are lodged there, then it's exposed to those.
So
it
an
can cause, yeah.
oral prophylaxis, how often should we get that? Is it
Well,
every 6
ideally
months, yearly?
Every 6 months.
Every
Okay.
6 months.
When I have patients who have bleeding gums, I ask them to come like every 4 months.
That's like
So
your
we
gums
can-
already not thinning out, and you have to take
Yes.
care because otherwise you'll have
How do
movable.
gums thin out?
You'll have
Well-
movable teeth.
What? I'm
Did
sorry.
you learn that in school too?
Yeah.
What did you say? I missed it.
No,
But
because
let's have the dentist
Oo nga.
explain
in the
everything.
okay. So you have to brush your teeth using soft bristles.
Oh no.
And gently.
We can-
slow and gentle.
I'd want for you to reiterate that because there are some who would want the hardest bristle
and fast.
possible.
They make it quick.
And like
quick and fast,
So
right?
and then everything's bleeding already.
That's
you
right.
guys, doctors, I like medium or hard bristles. But if you
No, it
put
has
the
to be.
soft,
Huwag naman
it
yung
doesn't do
super
the
soft na pang baby.
I know, but to me, even like the soft for adult toothbrushes, but it doesn't do the.
Well, you know what? But it keeps it. If you have the soft bristles and you brush slow, then you brush more effectively, as compared to
The rough
Brushing
ones,
the-
right?
the rough-
What about
yes.
those motorized? Giving
Yeah,
you
what do
the
you-
rides.
actually they're number one because they're more expensive, right?
But okay, they're more
okay.
expensive.
Well, I mean, I'm thinking
But-
about the Filipino
Yeah,
consumers.
but
okay?
price aside,
price aside.
is it okay to use it? I mean,
It's also okay to use it, but like I said, you change your toothbrushes what
Every
every
6
4 months?
Oh,
Every 4 months.
Ano ba dapat?
8 months nga siya eh.
3 to 4 months.
3 to 4
I was going to say quarterly. So 3 months.
Every 3 to 4 months. If
3
you see your
months.
toothbrushes looking tired, like
Like they're like sprayed already.
Buhaghag.
it means that it doesn't clean effectively.
In reality, you're not even supposed to reach that stage.
Exactly.
Just a little. It's like your hair with split ends. It's time to
I'm
visit.
looking away.
It's time to visit your hairdresser to have it cut. So these bristles, if I'm correct, the moment you see them not standing straight
Yeah.
anymore, just in the beginning, because
Not only
otherwise,
that, because the top of the bristles are the cleaning surface.
exactly.
Oh, so the
So
moment
once they're-
okay.
This
It's not
way,
it's not effective
This
anymore.
one touches the tooth surface, and your tendency is to push it harder. So that's when you.
And I can just imagine for some who actually have these toothbrushes that are like flattened out already. They're not even standing anymore.
the
So you can just
bar.
imagine
So it's not
a
the cleaning
plastic.
surface anymore. So it doesn't. It hurts
And
your gums.
because-
it shaves
Yes.
off the enamel, thins
And
out the enamel.
Because it's not properly
the cleaning surface is not.
not just that, but it actually injures the other areas that aren't supposed to be hit that hard.
Ano ba talaga? Ano ba? Ikaw ba
Well,
orthopedic
let's-
surgeon or
No.
dentist?
No, I just happened to have a long conversation with the group from the Manila Dental Association.
I
So
see.
I gotta have some of the best. But I would want to ask our lovely dentist here, point blank, how do you really brush your teeth?
Oh, I should.
I mean, it's as plain as that. How do you brush your
Pero
teeth?
hindi, parang you sing a
Kasi-
happy birthday song like you're washing your hands
it
or
has
something.
to be circular motion.
How do you sing? Okay.
No, in your head.
You brush with a circular motion instead of the right and left, like how. they were-
Circular.
Yeah, circular.
Paano sa molars, Doc? Parang
Yeah,
hirap naman. no?
actually-
Circular. See, she's doing
yeah,
it.
circular when you're doing sideways before
And
you
then-
can push your gum upward. It's already the motion is already
Yes,
going down.
going around.
See, you don't
Oh my
do
gosh, I've been
this.
brushing low.
Because the reason why I'm saying that, because not long ago, long ago, I used to brush the straight way, and when they do their prophylaxis, they see. I mean,
Oh, yes.
we can't see
We
it,
can see the-
but they can see
they
it.
see
and
the
it goes,
evidence.
Then
We
they go,
can see the evidence.
you
I'm
know
never
what?
gonna get a prophylaxis.
We can see the straight lines. It's not supposed to be straight, so you're brushing the wrong way. So that's the reason why I wanted it. I mean, not coming from me, coming
Are you
from my
judging me,
dentist.
Doc Tess? I don't think
No.
I've ever had a prophylaxis.
No.
Except,
She is.
Not at all.
oh my gosh, I don't think I've ever had one. Except when
Seriously?
I had
At
maybe
least
my tooth
every 6
extraction.
months.
Does that count?
No.
I was gonna say it's not kaya nga prophylaxis. It's different
So
from tooth
ashamed.
extraction. Not just the spelling, but the entire words are different.
No, because diba, you're already there. You might as well. Oh, we'll give you a prophylaxis as well. No, I guess that doesn't work that way.
No, but
This-
you know what? Let's see. Your cars, right? Your cars. You know when it's 5,000, 10,000, you get
You go get
change
one.
oil,
I'm kind of
right?
delinquent with my car.
So I mean, with
You're talking
your
to the wrong
teeth-
people.
With your teeth,
You should be in pit stop talking to the right people.
or you want to go to a spa for massage for your
Yeah.
body, your aching body. So it's the same way. Treat your teeth to a spa every 6
And it
months.
feels so
Every 6
good
months.
after prophylaxis. I mean, you can rinse, you can feel the water running in through
Those
the teeth,
triangles.
through the teeth. You can
triangles.
feel it. I mean, it's such a good feeling.
Okay, so Doc Tess, when's the
Parang
next?
dahil kumain ng pagsigarilyo, di ba?
When's the next available?
Schedule. We're gonna have our schedule ready.
Go from here.
No, Doc Tess, going back to TVP Dental B, what does it mean to you personally that Dental B is completely Filipino owned?
Actually, it really meant a lot for my dad that it's a Philippine-owned because of the Filipino innovation, Filipino hard work, and Filipino pride.
Oh yeah.
So,
Pride is a really good thing.
in every product that we create, supports local business and shows that that we can succeed with on our own.
Yeah.
Yeah. So
Beautiful.
And it gives a whole lot of jobs to a whole lot of Filipinos as well.
that's right.
For those who just tuned in, we have Doc Tessa Portillo-Sy, DMD. She is with TVP Dental B. I am Negatron. And Mike, we just answered your question. DJs and doctors, which bristles of toothbrush is better po? Again,
Yeah.
Doc Tess.
Well, the dentists recommend soft bristles.
Okay, and
Soft
circular
bristles.
Yeah,
motion.
Circular
because
motion.
and
Not-
and
what do you call that?
Just slow and gentle. Take your
Oh,
time.
how long? How long should it be?
2 minutes maximum.
Oh,
2 minutes.
Overbrushing also is probably bad for your gums. No,
Just
Doc Tess?
take your time, but sometimes, most of the time, people are in a hurry.
Yeah, they go, "Shh, I'm done." I go, "What the heck? Did it even clean your
and
teeth?"
you know what? Don't forget, flossing is also very important.
Oh, I'm sorry. Yeah, no,
Yeah,
let's not talk
flossing.
about me. Let's
Flossing is
Flossing.
very important. And I really recommend flossing. It's like it's like when you give yourself a shower and you're not scrubbing. You're just in the shower, literally in the shower, but you're not.
So soap suds are still in your body.
So you just have to compare it with those little things that you do. Oops, kailangan pala.
And the least is, even if you don't have any disease entity, any pain or anything, at least every 6 months, have yourselves undergo a prophylaxis.
And also, I have to add this, Tom. When do you change your toothbrushes? I said every 4
3
months, right?
to 4 months.
3 to 4
Yeah.
months, right? But if you recover from a cough or a flu, change immediately.
Oh, because the same bacteria is there.
Yes, the bacteria is there. Because, I mean, oral cavity, you might have some
It's
bacteria
the
there.
most dirty part.
It is, exactly.
Yeah. So,
I will agree with that. That's the reason why for us, if we do have patients who've undergone surgery with implants,
Yes.
and they would visit the dentist, we'd tell your dentist that you have metal in your body so that you
Yeah.
can actually give the necessary antibiotics before any procedure.
it's why also it's important to have oral prophylaxis every 6 months.
Oh my gosh.
Is because those little calcular deposits that might have been lodged in the gums,
Oh, yeah.
it eventually can cause infection. And when you have infection, like gum infection,
and
and when
to
it's
the
in the
brain,
gum, the infection can go up to the
Exactly.
brain,
you
or to the
guys.
heart.
and it's
To the
just the real prophylaxis, and not because some others would actually be picking out those instruments and picking out on their own. So that's not the same thing.
It's not the same thing because you don't have the, access to the visibility to the back molars and all that. So
More of Doc Tess here on HealthLine, and your comments and your shout outs after maybe this track from John Sam called Kanta Kay Ella on today's Best Music.
Magic 89.9.
Magic 89.9.
And the song's called Work here on today's Best Music, Magic 89.9 HealthLine with Tina Ryan and Doc Rylan. And we have Doc Tess Portillo-Sy, DMD from TVP Dental B. Oh,
That's a whole lot of TVs and Bs.
Designer Dad says, ako, gusto ko every 3 months magpa-cleaning. Cute ng dentist ko eh. Motivated magpalinis.
Okay. Well, at least the upside is you have clean teeth all the time.
Oh my gosh.
your dental visits should always be pleasant.
Oh.
Diba?
So who's your dentist?
Oh, we have a first-time chatter on twitch.tv/magic899TV, Sinyari.
Hi.
I hope I pronounced that right. Sabi din ng isang dentist sa TV spot, bukod sa circular motion, konti lang ang rinse dapat para effective ang fluoride sa pagtibay ng ngipin. Nox. It sounds like a commercial ad.
I know.
Okay. Hi, Mike. Again, congratulations. He apologizes. I didn't catch that earlier because he's currently busy now for graduation errands. No.
Wow, congratulations.
Okay. Negatron. Hi, I am Negatron. And Christian says, hello, Doc Tess. Victor Torres. Coach Ben.
Hi, Coach Ben.
He will be joining us next Tuesday here on HealthLine.
Looking forward to seeing you again.
So si Coach Ben magbabike na lang daw papunta dito next week. Okay, so Doc Rylan, your next question for our beautiful guests.
No, we were talking about cleaning teeth and everything else. But let's start off why it becomes dirty or discolored. I mean, there are a whole lot of things from coffee, cigarette smoking, most especially in vaping.
Totoo ba talaga yan, Doc?
Yeah,
Doc
because
Tess,
nicotine.
Yeah. Nicotine is, okay. Yeah.
It usually stains the
It stains
enamel.
the-
Yeah.
But what about wine and all the other
Yeah,
drinks?
and the red wine.
Oh, yeah, because I get that sometimes.
Yeah.
That's why we drink white.
Palusot. Okay, what are the foods that really we should avoid, Doc? Gusto namin ng, oh my God,
Actually,
clean
you
teeth.
can just eat any food that can stain, but except that you just have to brush maybe immediately, or make sure that the stains are
that was
off.
that was what
Yeah.
my next question was going to be.
Because I don't
so
want to restrict
presuming,
you. Yeah.
presuming you drank a glass of wine, you ate chocolate, you drank a cup of coffee. So what's the next best thing for your teeth?
Well, if you're ang corny naman, no? Yung iba kasi you can't have your coffee sipping from a straw, right? So that's
Well,
not so fun.
I'll
If you
think
want,
about-
some
I'll think
people
about
kasi
it.
they want to protect your teeth from.
So you
getting
drink
coffee.
from a straw? Paano lang sa QC? No straws kami.
Ay, meron naman yatang meron naman yatang
What's this, the reusable ones?
Yeah.
Those metal straws?
So some
glass
have
straws.
the cold coffee, or sometimes
Oh.
my patients have like those invisible retainers for bleaching trays that they use also for.
I've seen
to
that.
protect-
meron na
I've
nun?
seen that, but I've
Yeah.
seen some of the smokers use it.
Correct.
I've seen,
Because it protects the
Because-
enamel.
Ayan,
You
nagbigay
can-
pa tayo ng idea.
yun na nga eh. Oops.
No, but seriously, Doc, you know, for the listeners, what's the most common brushing mistakes you see among Filipinos?
Using they're always in a hurry, so the tendency is for you to brush harder. It doesn't mean that if you brush harder and faster,
It's cleaner.
It's cleaner. No,
So
it
hindi
doesn't work that
nakukuha ng
way.
pagka-brusko
No
yan.
no It has to be like you take your time, and not naman take your time, but you know, brush gently with soft bristles and then flossing.
And you know, honestly, Doc, that's how I normally injure my mouth, and that's how I end up getting all these singals because I tend to brush so
Let's
fast.
go back to
That's
that. So
right.
if you do have, because you've been brushing too fast, too soon, and
Yeah.
doing
So
everything
the
else,
tendencies you just kind of-
what's the remedy that we can do? I mean, it might happen, but what's the remedy we can do about it? None.
Change your toothbrush technique to a more efficient.
You hear
and,
that? You hear
yeah.
that?
So you don't just keep bruising your thing, you know, mali na
But
nga.
if you do get a sore because
Sore.
of it, what's your first aid for that?
Actually, yeah, what I, you know, those in a tube, like for those babies with growing.
Yes,
yeah,
that one.
you can use those
For teething.
For teething, yeah.
Oh,
And then when I'm in the States, I buy
okay.
those gels that
You know, nothing's effective
What about
to me. But
what about no?
ano yung
Well, I was
oven?
gonna ask. There are some.
The Bactero talaga effective sa akin.
No, no.
Where do you buy
not the ones.
those?
No, I have to go to the dentist for that.
Okay.
But what I'm saying
Yeah,
is the strong mouthwash, the strong ones.
Okay.
Sometimes as a repair, I put it in one of those earbuds and just like touch it. It's kind of painful, but at least it closes up a little faster.
Oh, that
Because
works for you.
Good.
It works
It has
for-
that burning sensation.
The
also
burning
like
sensation, yes.
The back
but not as burning sensation that like
Can.
Guys,
Yeah.
can I just share? If you have Singao and you really want to try the Bacterol, it's not for the weak of heart. I mean, like,
I know.
it is painful.
That's why.
It
That's,
is.
It must be a form of torture, actually.
Yep.
You must be a masochist for that.
Right. No,
But-
but it's effective because the next day, tuyo na
Yun
siya.
lang, the next day for
But
you.
it's super
But
painful.
the one I do, well, it's not that often, but when I do, it has to be the strong type because there are other mouthwash. I mean, you know, all of these flavors. There's some light and whatever.
Yeah.
There's some even colorless. But the strong ones, won't say the brand, but yeah, not one day. Siguro mga 2 or 3 days.
Also, be careful of the mouthwashes that you use
Because
because
of
there's
alcohol content.
I don't recommend those that are alcohol based.
Okay.
Because
okay.
they're, or if you use the alcohol based, it has to be just like a drop or two in a. Yeah, but others could say you can use as
As
pure as
Yes.
they are, like the betadine.
That's the reason why there are a whole lot of variants of this.
Yes.
There's one that's like they have like what 20 variants
Yes.
from the strongest to the mildest form.
Yes.
So, ito, Doc, let's, we're just gonna debunk the myth already that brushing harder equals to cleaner teeth.
No.
Okay.
No.
Guys, did you hear that? Okay.
Nope.
That we made sure
Because
of.
when you brush harder and faster and harder, and that kind of contributes to the gum infection, bleeding of the gums, which is
Because of
would
the
later
injury.
on lead to
An infectious
an
process.
infection, and later on progresses into, mobility of the teeth when there's not enough.
That was what I was mentioning a
Yeah.
while ago.
The
Because of
gums that
cleaning
are
of the
holding the
gums.
teeth, yeah.
Do we brush before or after breakfast?
Actually, any will do. It doesn't. There's nothing
why would you
wrong
brush-
before or after.
Why would you brush before? The taste wouldn't be the same, especially if you have good food. It's after. I mean,
It's true, no? Ang pae. Or like, it just tastes
I mean,
funny.
it'll taste toothpaste.
It just tastes funny.
would brush before and after.
Oh my gosh.
But normally I don't take
Wow.
breakfast, just coffee. So I just do it after.
For those of you who just tuned in, we have Doc Tessa Portillo-Sy, DMD, joining us this hour. She's going to stick around because in our second hour, we're going to have
Dr. Bong Tagle, and we'll continue the discussion on erectile dysfunction.
Okay, I have room for one more song before I take a quick break. How about the latest from Chris Brown, Doc? What do you think?
Go.
This one's called Press Me. Press Me! On today's Best Music.
Magic 89.9.
This is HealthLine.
Magic 89.9.
Today's Best Music, Magic 89.9. Dove Cameron with Too Much. Before that was Sky Newman's Walk and Vault Boys Closer. 3 in a row on today's Best Music.
Magic
'Cause, yeah.
89.9.
And this is HealthLine for 11. We are still joined by Miss Doc Tessa.
Miss Tisa.
Doc Tessa
Yes,
Portillo-Sy,
yes.
DMD. Here we go. For those who just tuned in. And of course, TVP Dental B is a
Filipino-owned
company.
I mean, it really is the bragging rights because of the pride that it's Filipino-owned.
Now, when it comes to being Filipino-owned, I got used to calling her Ate Tess because the brother's a good friend.
It's the kuya.
Yeah, kuya. So, Doc Tess, how does supporting Filipino-owned companies impact our economy and local jobs?
Supporting Filipino brand helps create employment.
Yeah.
And it grows grow local companies, industries, and it strengthens our economy. So it keeps opportunities here.
So we should all switch.
And I think you've seen how it is. It's not just employment, but that employment creates the family that they're all in together.
Oh my gosh. I mean, the sense of family that I felt there.
I know.
I
I'm envious of
volunteered.
you.
I
I'm
volunteered.
envious of you. I should have.
I really volunteered.
And
I
I
want to
was
be part
just
of this
explaining
company.
to you earlier, we don't have any other brand. Product except toothbrush.
Just a toothbrush.
I mean, if we focused on other, items, then we might.
I was gonna say that's how good it is because they're concentrating
to be-
all their forces on just one product.
Doc, right.
We want to be the best, so we just can't
Not
afford
all-
to lose focus. And
That's so true.
Not only that, alam mo kung gaano ko sa yung mga empleyado nila.
I'm sure.
Two of them had the company name tattooed
Really
on
now.
their body.
That's how dedicated.
One's a chest
That's
and
how
one's
dedicated they are.
Yeah.
Oh, wow.
And then at the celebration, there was an employee na nakapagpaaral ng mga kapatid niya, di ba? Tess, nakapagpaaral ng mga kapatid niya. And then he was so proud na he was bragging about this little lot that he got for the family. And you know what the family did? The Portillo family? They paid for the rest of the the utang of the employee. I was just crying.
Jeez.
No, seriously.
I got goosies right now.
Gano'ng kasaya ang mga empleyado ng
Who wouldn't
TVP
be?
Dental B.
Who wouldn't be happy?
I mean, like,
Who
it's
wouldn't
just
be
a
happy?
one big happy family.
And he was from one of the little towns.
Yeah.
Our employees flew in to
Flew
Manila.
in.
Yeah.
So it's first time we've met them, but they've been
Seriously?
with us for quite
But
some time.
the feeling of being part of the family was really obvious, even
Doc,
if it's the
I mean,
first time I met them.
I've been hosting since when I was 16, but this has to be like top
So that's like a
5.
couple of years ago, because you're 18 right now.
No, but it was very heartwarming talaga. Like,
That's so
I was
cool.
just blown away.
That's so
Talagang the love of the employees for the company and the family.
And that's how actually you can see how strong the company is. You don't look anymore at the finances or the financials of the company. You look at how the employees are, how happy they are, and that's tantamount to equate to having
That's
a really
right.
good and stable company.
they're happy with working for us and the product that they sell. So it works.
Heck,
for-
I won't have it tattooed in my body if I wasn't happy about it.
That's
And
true.
not just happy about it, but proud about it. Because you can actually show to people that, hey, heck, I'm part of this.
Exactly.
Hiya pa siya nun, di ba? Hiya pa siya. You sure you tattoo nakagano?
Guys, don't go anywhere because this is just our second hour. We still have Doc Tagle. We're going to talk about
That one.
that one. The problem.
So it's the men's time this time. The men's time this time.
Don't be shy. I'm sure you guys have a lot of questions, but for now, let's focus on our teeth.
Oral din.
I didn't say that.
Oral health, okay? Si Victor is asking, Doc, nowadays, kasi nung 90s, di ba, ang braces is talagang wow, pang alta, pang mayaman lang. But now, it's more affordable.
It's, yeah.
The more accessible. What's the starting price daw?
Because there's like an orthodontist who did postgraduate, 3 years of just orthodontics, and then there's a different level of, let's say, orthodontic practitioner just attended the 6-month program, so they come in different, so that's where the price also range.
Oh, but is the quality of care the same?
Well,
I love
if you
how she's
She's trying to be diplomatic.
no,
She's trying to be diplomatic and polite about things.
No, because nowadays kasi the specific na diba? Orthodontic practitioner.
I don't even know the difference.
There is
it's a
the price
training.
range. The price
And
range.
the training that
The
one
training,
undergoes to actually be able to put
training,
these
yeah.
braces on you.
Okay.
So I believe the orthodontic practitioner, those who have just did the certain programs. I mean, there are a lot of programs that are
good naman.
yeah,
Yeah.
good, available naman, diba? But iba yung talagang nag-training ng 3 years, 4 years ng orthodontic
Sabi ko sana,
only.
it probably would have made a difference if, like, although they are only orthodontic practitioners, but they've been in practice for like 20 years. I mean, there's probably a difference.
Oo naman.
So, yes, I think these also kind of limit their practice to certain cases that they can only.
Oh, I see.
Yeah. So that's a difference. So
'Cause there's
that
a whole
explains
lot of,
the price range.
There's a whole lot of different subspecialties as
Yes,
well. Though we're just talking about the oral cavity,
That's
there are a
right.
whole lot of subspecialties involved.
Now, Doc, can, anong whitening toothpaste daw ang talagang effective?
Or
Do you
whitening
believe-
process, not just
Do
the
you even
toothpaste.
believe that in whitening toothpaste? And is mouthwash necessary or brushing and flossing enough?
Brushing and flossing, definitely priorities, brushing twice a day and flossing at least once a day. Okay?
Okay. So
And
brushing
then-
twice a day, flossing once a day. That's the
Kilala
minimum.
nga ako 3 times.
Yeah,
That's the
you can
minimum.
also every after meals, pwede.
Paano na lang
After
kung breakfast, lunch, dinner, then you have 5 meriendas and the midnight snack. So that's
yun
like
eh.
7 times ka mag-brush.
Upod na yung toothbrush once a month.
Di ba? Upod na
Once a
yung
month.
gilagid
Yeah, but
natin.
I want to go back to the whitening
The
thing.
whitening.
Do the whitening toothpastes really help?
Actually, the whitening toothpaste, they do have some changes. I mean, nothing compared to the dramatic effect of having it done professionally in a dental office.
Yeah, because I know that all of these gunk and everything else is placed on you. That they do all of these laser type things.
Yeah.
Guys,
I did it a couple of times. That's why.
wait lang, hindi nag-usap yung dalawang guests namin.
Oh,
Para
pero
sila nakapink.
Kakanta sila eh. Kakanta nga sila eh. Dr. Bong Tagle in the
Dr. Bong
house.
Tagle, meet Doc
Hi, good
Tessa
afternoon,
Portillo-Sy.
good afternoon.
Hello, hi, Doc.
Ayan. Oh my
Kasi, di ba, it's a happy...
It's a women's.
Women's Month.
Also,
Doc, can you come closer to the
Women's
microphone, please?
Yes.
There you go. Well, good to have you back, Doc. The last time Doc Bong was here at Tess, he
Yes.
made it in just the nick of time.
Nick of time to
Mag-goodbye
say.
na kami.
Nick of time to say. We'll be inviting him next.
We'll catch you back. Oh,
So this is the part 2.
yes.
Now I'm here.
Yeah.
Yay!
And I asked Doc Tess to stick around because
Yes.
it's going to be a fun topic.
Okay.
Yeah. So, Doc Tess, before we get to you, Doc Bong, Doc Tess, we want to thank you so much for being
thank
here.
you. Pleasure is all mine.
Again, your final message to our listeners.
Okay, just consider your mouth as a very important part of your oral health. The conditions of your teeth also matters. It plays an important role in maintaining our health.
Yeah.
So yeah.
And if they want more answers from you, or if they have any more questions, where
Or they
can
have
they
to have
reach
the
you?
prophylaxis and the teeth
Oh,
whitening.
tayo mo gusto magpa-prophylaxis.
Ayan, basta every prophylaxis in my office, every 4 months, libreng toothbrush. Oh, ayan ha.
diba?
Ayan, no excuse na not to change your toothbrush ha. So, if you need a new toothbrush, I need my prophylaxis.
Oh, yun na.
Okay.
Give my love to Abby and Daddy Harry and everyone at TVP Dental B.
Yes, of
Thank
course.
you for being
Now, see
here.
you soon.
But just to be here till
Oh yeah, she's gonna stick around because
I'm
oh my
gonna
gosh,
stick
I loved how they're so cute, matchy. 420
Matchy-matchy.
on HealthLine. Let me play one song and then we'll have Doc Bong Tagle with us to talk about what most men are maybe trying to avoid.
Avoid and
You
afraid
think,
to
Doc?
ask.
You know, what do you think, Doc Tess? They avoid that topic.
Yung binubulong lang.
Oh, sige. Here we go. This is HealthLine.
Magic 89.9.
Digging it. Nayona with ABCD. Hey, you know what? If you just tuned in, this is a HealthLine where your health questions get real answers from real doctors. And from oral health, we now move on to it's a bit medyo sensitive. A bit na medyo pa. Ano ba yun?
Sensitive.
A bit sensitive, but very
Sensitive.
important. We're talking about kidney health, prostate problems, UTIs, kidney stones, erectile dysfunction.
And you really had to give the
All
accent
things-
on the last one.
All things urology, okay? Because if you pee, this episode is for you. Welcome back! Board certified urologist, Dr. Wilfredo Bong Tagle.
Good afternoon.
Hi,
Thank you,
Doc.
Tina.
Pretty and pink. Pretty and pink. Okay, Doc, I'm so glad you made it. Thank you so much for
Thank you
being
for being
here.
with us.
Okay, Doc, let's start with this. When people hear urologist, ang naisip agad, men's problems.
Yes.
Men's problems.
They don't know that urologists also take care of women.
Yan.
Yeah. Because
Ayun ang sabi
we
sa'yo,
take care
Tessa.
of all the organs that the urine passes through, from the kidneys to the ureter to the bladder and out. And on the other side, the sexual problem, the genital or the reproductive organs of males.
Of males.
Because the reproductive organs of
OB yun.
females are OBGYN.
Gynae.
Okay. Sa gynae na yun, sa
Yes.
gynae. Doc, why are kidney stones so common now?
It's because of our environment.
Look.
Usually, it's secondary to diet and hydration.
Sabay
You gotta
ka.
drink a lot of water. You gotta
Since
drink a
our
lot of water.
country is hot, so we perspire a lot, and the water in our body goes down. Plus, we used to eat a lot of salty foods, wherein when it passes through the kidneys, there will be a lot of concentrated particles,
Oh my gosh.
salt.
Hold on, let me just
Then
get what I
it
was
will
eating.
aggregate and later on become the
Pakita ko
stone.
lang kay Doc para pagalitan ako. Go, Doc.
That's why you really have to drink a lot of fluids.
When you say a lot of fluids,
Kasamang beer doon.
The recommended is 2 to 3 liters of fluids a day.
2 to 3 liters.
Fluids.
Water, coffee, juice, soup. The problem with beer is it has a lot of uric acid.
Oh.
So you
So
will
it doesn't
also
count?
prone
Coffee
to-
and soup, bawal. Hindi ka, it
No,
doesn't
no, no.
count. Oh, man.
It's part of fluids. So it's okay.
And I'm eating potato chips as I say that, guys.
That's salty.
I know. Okay, guys, if you have any questions, ano daw? Pasked na daw ulit kay Cute Dentist. Okay.
Yes.
You guys, twitch.tv/Magic899TV. If you have any questions, we do have Doc Bong Tagle now. He is a urologist. If you have any questions, please send them our way. Our Viber hotline, Doc.
Our Viber hotline, ito na naman, nawawala na naman yung aking Viber hotline. Na, it wasn't there a while ago. But anyway, of course, our Viber hotline is 0945-971-4011.
Pero Doc Tagle, I don't know yet. How do I know pag may kidney stones pala ako? Anong
Usually,
symptoms?
it presents as heaviness at the back area, the flank area, or problems in urination.
When you say heaviness, like,
It won't start as severe pain.
Okay.
Even just a heaviness or galay.
ngalay? Oh my
Yes.
gosh! Okay. Sabi,
That's
kaan mo na ng potato chips, Doc.
So, habang sinasabi yung alay, potato chips na nasa harapan niya. Kaya siya
Oh my God. Okay, so it doesn't start off necessarily with like sharp pain.
Yes.
Ngalay muna.
Yes.
And then, pag nag-sharp pain, doon ako tatawag kay Doc
Parado
Rylan.
na talaga yun.
Hindi ako. Siya ang urologist. Orthopedics nga ako.
Hindi
eh.
kaya sabi mo,
Ibang bato,
Yeah.
hindi buto.
kasi tatawag ka kay Doc Tagle. Sabi mo, tumawag ako.
But do you always have a blood in the urine every single time that there's a stone?
Not necessarily.
Not necessarily. Oh,
Yes.
okay.
But it's one of the signs.
So,
Usually, if not a gross hematuria or gross urine in gross blood in the urine, it can be a microscopic one.
that's why the urine exam is also
It's very
important.
important.
Oh, okay. Doc, hang on. I do have to take a quick break. We have more questions for Doc about UTI, and then we'll move to the favorite subject of the men.
Yeah. The
Okay,
the
you
lines
guys-
are actually burning up right now.
Oh, don't pretend, you guys.
Puro anonymous calls daw eh.
HealthLine with Tina Ryan and Dr. Rylan Flores.
Discover the
Magic 89.9.
Today's best music, Magic 89.9. Madison Beer, Bittersweet. This is HealthLine 436 on the show. I don't know why Doc Rylan just stepped out, but I'm stuck with two amazing doctors. One's a dentist, one's a urologist. Now, Dr. Bong Tagle with us. Kakatuwa kasi pare talaga kayo naka-pink. I love it. People on Twitch.tv, di ba? Ang cute nila. Doc Bong, why is UTI so common amongst women? And bakit siya pabalik-balik?
One of the common diseases is urinary tract infection. 10% of all doctors visit are
UTI?
UTI.
10%. Wow.
Would you say that's a big chunk?
Of course. Because some goes to the internal med, some goes to
Yes.
GYN, some goes to other doctors, family
Heck,
meds.
they even come to me.
Yeah.
Ano percent?
They even, well, it's not as
not
many
10.
as the urologist, but yes, I do
So, mas
have
mayaman si Doc Tagle
No,
sa'yo?
kasi naman, yes, I will agree.
No.
Nasa relo yan, tinan mo relo niya. Okay ba? But the point is, they come in because they
The low back pain.
the low back pain. The misconception is it's because of, is it
UTI.
stones or is it because muscular? So sometimes we refer each other's patients to each other.
Mali pala yung symptoms, ganon.
Diba?
So it's very common actually. Urinary tract infection is very common.
So bakit pabalik-balik, Doc? Pwede bang ang reason ng iba is, tama ba, holding urine too long?
That's one.
Ipipigilan.
Because if the urine stays in your bladder for more than 4 hours,
4 hours?
4 hours.
bacteria would start growing.
See, I didn't.
It's 4 hours.
I didn't know that.
I didn't know
Okay,
that if
okay.
you're at the test.
No, because urine technically when it goes out of the body is sterile. Kaya nga hindi masyadong, di ba, sir, walang amoy, walang, but
It's
let it
supposed to
stay.
be aromatic.
Let it stay for a
Aromatic.
bit. I mean, the pungent smell of urine will eventually come up because that's a part of a bacterial
Ammonia.
infestation. And the ammonia.
Yeah.
You know, now that I think about it, I think the times that I had the UTIs when I used to like sleep so long, like, mag-hibernate
That's why
ako,
you look
Doc.
at your clock as well.
But some UTI may pain minsan wala. When you pee, di ba? There's a time that may pain, minsan wala.
Oo, so ano yun, Doc?
That's it.
How do we know?
Usually pain comes from the inflammation. If the infection produces inflammation, that's the time that you will feel the pain.
So medyo, ano na.
Yes.
Okay. Doc, UTI, speaking of UTI, di ba? Cranberry juice, buko juice, nakakatulong ba talaga yan or myth lang yan?
Yes, lahat na
Clear.
halamang gamot na pampaihi. Yun
Like
ang
what?
nila-
Like what? Like what? Like what?
Sambong, banaba,
Wow!
ng mais,
I mean, I'm sorry,
Buhok
Doc.
ng
what?
mais.
Yes.
Okay.
Hindi, ano pala
Kinukulo
yun?
o merong tablet na
ugol.
nakaganyan?
They are all diuretic.
Wait, so
Pampaihi. So, pag ihi ka ng ihi, nawawash out yung bacteria.
okay. So when you're going through a UTI, you're supposed to pee it out na lang, Doc. That's why you recommend hydrate or just
Yes.
anything. Okay.
A
Flush
listener,
out the bacteria.
a listener just mentioned, Sir, yung beer daw ay also diuretic. So okay lang daw ba?
Okay lang, but the problem with the beer, ang taas ng
Uric acid.
Uric acid, ha? You heard that right
Yan na
here.
naman.
Magkakaproblema ka naman sa joints mo, you go to
That's why you come to me.
Okay, gentlemen, I know a lot of you guys are listening. Let's talk about the prostate. What age should men start worrying, Doc?
Okay, the prostate is a secondary sexual organ of the males.
Okay.
Then, at the time of birth, it's as big as a peanut.
Peanut.
Yeah. When
Okay.
it goes to when the
I feel like I'm back in like school or
male
something.
becomes teenager,
Your imagination is...
it grows slowly, then goes to its normal size, which is around 20 grams, like siniguelas. So you will have an idea.
Siniguelas.
From peanuts to siniguelas.
Yeah. That's
Okay.
still normal.
Okay.
Siniguelas
after-
is that green-violet thing?
Yeah.
The small.
Yeah.
Sorry.
The one with the
I had
big,
to be, I had
the
to
one
be
with the
sure
big
about
seed.
it.
Yeah.
I had to be sure about it.
Ang tanong, panahon na ba? Okay, so...
Then after the age of 40,
Oh, lumalaki siya?
that's the time that it will grow
40.
as big as you can. Magiging kasi laki siya ng santol. Or Bangkok na santol.
Oh my gosh, Bangkok Santol is like that big.
Yeah.
Whoa!
Seriously.
Does it stop growing at some point?
No.
Wow.
It will grow until you die.
Oh my.
Some
How do you
have
prevent
signs
it
of
from-
obstruction. Some doesn't have signs of obstruction.
Oh, okay. So not
That's
all
why you
will
don't have
obstruct.
problems of urination.
Not all obstruct regardless of the size.
Yes.
Oh my gosh.
Oh, that's why.
Doc Tess has a question.
I was just wondering, what causes that blockage or infection in...
Yeah, because the urethra or the passage of the urine passes through the between two lobes of the prostate.
So it's like sandwiched.
Yes.
The actual urethra is sandwiched
Yes.
in the prostate.
Yes.
Okay.
Next time dapat may visual
when
ano
it
tayo.
grows, when it grows to the middle, it will closes the path of the urine.
So that's why.
That's why there's
Oh,
obstruction.
so-
But when it go bigger to the sides, and there will be no obstruction in the middle.
It flows better.
So it's not an automatic thing that just because it increases in size, it will give you problems in
Yes.
voiding.
Yes.
Oh, that's why. Because we see elderly who are having problems with with urination, but we also see similar elderlies in the same age category that seemingly don't have any problem, and they
Yes.
just enjoy things.
Yes.
Wow,
Okay. So,
I didn't know that.
hindi ko alam na it gets bigger pala as you guys go older.
Bangkok Santol nga eh.
Hindi kasi yun ang
Which thing?
tinitignan eh. Tingnan eh. Ikaw, iba yung
Bangkok sa
bigger
Nabubuking
eh.
ka
Ikaw
tuloy.
There's no obstruction.
Oh, Doc, okay. So, natatawa lang talaga ako kasi I don't, okay, first of all, it's, I aesthetically, this is just me, Doc Tagle, ha? And please don't judge me. I just don't, I mean, aesthetically, I don't know what it's for. It's just,
Iba nga ang focus ni
yeah,
Tina.
I mean, I've seen dead bodies.
You cannot see that outside.
Yun na nga, it's inside.
How would you actually be able to examine a prostate? Kasi inside ka nyo eh.
Oo nga.
Yes. You do it through digital rectal exam.
Oh,
Using
So
a finger.
that's the padre.
Other people. Not yourself.
So
You cannot do it by yourself.
That's the padre.
Yeah,
Digital
padre.
rectal exam ka.
So it's like an IE for women?
Yes, like that.
okay, Doc, how common is prostate cancer in Filipino men?
The prostate cancer is the third most common cancer in males.
What's
the
first?
number one is lungs.
Okay.
Number two is colon. Number
Oh.
three is prostate.
Prostate.
Yeah.
Pero di ba they say, Doc Bong, and correct me if I'm wrong, prostate is like parang,
Breast cancer?
Knowing sa dinami ng cancer. It's parang yun yung, it's common naman eh.
Not really not common, but it's the least aggressive of
There
all
you
cancers.
go.
Yes.
Yeah.
It's a very slow growing cancer.
Slow growing. So usually we've had oncologists on board and they say it's the doubling time, doubling the size of the cancer. How slow are we talking about?
There's a study that says when at the time of diagnosis, early stage, it would take 10 years to 11 years
10,
before
11 years.
it
Oh
shows
my.
Oh,
the problem. The signs
before
and
it shows pa. It's not even doubling pa. Before it shows lang.
Yes.
Wow.
This is prostate,
That's 10 to 11
Is
years.
there like a procedure that you can, like for women, like mammogram for the
Yes.
breast? Is there like a
Of course,
procedure
yes.
for that in men?
Yes. We have the ultrasound to
Ultrasound.
know if there are tumors, there's mass. We have the PSA. It's a blood examination.
So blood.
the
Okay,
prostate
PSA.
specific
Specific
antigen. Yeah, I
Okay,
learned that in
got it.
school.
Okay.
Then when it persistently elevated, you can go to the multiparametric MRI.
Oh my
I see.
goodness.
Okay.
4:45 on HealthLine. Doc Tagle joins us here, and we're going to talk about ED right after this song from Maki. This one's called Kahel na Langit. Don't go anywhere.
Magic 89.9.
Maki with Kahel na Langit on today's Best Music. It is 4:48. And I'm joined by two wonderful doctors. One's a dentist, one's a urologist. Three pala, kasi si Doc Rylan,
That's
my
right.
partner, orthopedic surgeon. Sabi ko, I'm joined by two doctors. Ikaw rin.
I'm the third. I'm here.
Sorry na, sorry.
Wala. Kinalimutan agad ka ako.
Pagkatapos manliban na ng turon.
Wala na sugar rush. Nag-down na eh.
Oo. Doc, let's talk about erectile dysfunction.
ED.
I had a buddy who says he thinks that it's becoming more common, especially among Filipinos. Do you agree?
Yes.
Or it's just been-
That's the usual question I get.
Oh.
I have a friend.
I told you, I told you all the questions that are going to be coming up are
Sinare
all
lang
anonymous. They're anonymous.
Oh my gosh. And Doc, how
That's
true?
very common.
Mga Filipino kasi mga pasyente niya Pilipino naman.
ED daw can actually be an early sign of heart disease? Is that even how? Or
Because the physiology of erection is it's vascular. So if you have a heart disease, usually your medicines, your medications are all to make it
Relax.
relax.
Yeah.
So how can you have an
Erection.
with a relaxed
With a
blood vessels?
Okay.
okay, guys.
So that's why if you're taking in antihypertensives or any cardiac medication, the likelihood side effect is
But it would be a prolonged intake.
prolonged.
Wait, I'm sorry.
intake.
Okay.
Okay.
Okay. Interesting.
And it's right that you just can't use any other medication if you're on these medications.
You have to look for a medication that fits for you.
So like yung
There are a lot of antihypertensive
like yung mga
drugs.
yung mga blue pills na tinatawag nila ganon.
The
Iba
blue
pa
pills
yun.
is good.
Okay. I'm saying the word like you can see me
it's
on
good,
air.
but you're supposed to take it. You're not supposed to take it if you have something like a disease or a drug that you're taking in. Diba, it's not safe.
It's not safe for only one. The one that are coronary dilators. The one that you put under your tongue.
Oh, the
But
nitrates. The nitrates.
But the antihypertensives, no.
Oh, so even if you're on antihypertensives but without any nitrate component, you can
can.
take the blue pill.
Yes.
Oh, not that I do, but
I think I'm gonna get in trouble if I asking for a friend. Guys, we have a Viber hotline.
if you notice Tina's phone, it's like it's blinking left and right. It's like,
My God.
so she has a lot of friends right now.
Dumirekta na kayo sa Twitch natin. Oh. Sabi daw kasi ano daw opposite ng ED. Kung may ED ba, meron daw bang, normal daw ba yung lagi na lang?
Aba. Okay na problema yun.
Doc, meron ba nun?
That's common. I have patients who says, Doc, I have problems with erection. What?
It's too much.
It's too much. What
I was gonna say,
you're gifted.
good for you. Good for you.
So it's a good problem to have instead of ED.
Usually they're preoccupied.
Diba? That should be stimulated. Hindi naman pwedeng the whole time nakaganyan yan, diba?
Yes.
I'm just saying that
There's a
May ano yan.
pathologic erection. That's priapism.
Well, I'm sorry, what is it?
Priapism.
Priapism.
Wherein there's excessive dilatation, the size of the genital or penis. Then to the point that it becomes painful.
Oh.
And it's not associated with sexual excitement.
Okay, wait. Not associated with sexual
wala rin
excitement.
kwenta.
Useless.
The problem is it's painful.
I can imagine. I can imagine. Kasi
Okay.
Guys, but can you direct your... direct yun na yung questions just sa Twitch, ha? We have a
May
Viber
ganyan.
hotline. Oo.
Yeah.
Okay, wow. So, anong tawag sa condition? Ano?
Priapism.
Priapism.
is that
And-
common?
So that's a new word.
Filipinos?
I have several cases, but it's not that common.
What's the age range for
Usually,
mga ganyan?
teenagers up to 30s.
Oh, so it's usually felt at the younger age group.
Yes.
Not the senior citizen ones. Swerte ng senior citizen experience. Yeah.
Ikaw naman, blue pill na yun eh.
Doc, normal ba umihi 3 times per night?
The
What
most
age?
common signs of problems of the prostate is nocturia or
Polyuria at night.
urinating at night.
Nocturia.
Urinate. Oh,
And the normal
often?
is
Oh, yeah.
1 to 2.
Oh,
3 is
1 to 2 in how... Because sasabihin ng iba, Doc, saglit lang ko matulog. O, Doc, mahaba tulog ko. So, in what time frame are we talking
Oh,
about?
Doc, paano yung... Doc, malito yung pantog ko. Ganon. Meron ba nun?
The pantog is can accommodate up to 500 cc.
Half a liter.
Yes.
That's half a liter.
So, if you can 1 cc per minute, so half a liter is how many hours?
I'm poor in math as well.
Me also. Kaya ako nag-dentist
Okay.
na 32
We
lang.
left the chat group. Naiwan si Doc Bong mag-isa, guys. Naiwan si Doc Bong.
Tay, pare-pareho pala tayo.
Mga 5 hours.
Oh, okay.
So, if you go to sleep and to fill it up around 4 or 5 hours,
That's okay.
so when you go to sleep for 8 hours,
So, twice
you
ka nga.
have, the most is twice.
Oh.
But if you are urinating,
4 times, 5 times, 6 times.
yes,
Oh, I should
there
go
will be a
check.
But I have a
problem.
question. What if your intake of the fluids are mas marami? Kaya mas madami ka rin
Yeah, so
mag-urinate.
you're gonna wake
Diba?
up. Every-
Your filtration is maintained at 1 cc per minute. So even if you take a lot of fluids, you will
So it's
develop still the same volume
Yeah.
of
Oh,
fluid.
so it's
Okay, I
not
got
true when they say that
If you drink
for
more.
some patients
Yeah.
that become dehydrated and they say, I don't want to drink water in the evening because
They're making
wee-wee
wee-wee."
ako.
So that's not necessarily
not
true.
necessary.
Oh.
Who told me that?
I know, right?
Right. We were all told that growing up. Okay. Wow. Okay.
Because the filtration of the blood in the kidneys is constant.
Oh, that's so true.
Even
Because
if you have a lot of fluids in your body.
so it's not necessarily true that I drink water right now and I'm gonna pee right now afterwards, because it still has to be filtered up by the kidneys.
Yes.
Well, but I think there's a exception. I swear, Doc, talaga. I maybe have an overactive bladder. If I drink something, I'm gonna pee it out in 20 minutes. I guarantee
Your
you.
bladder is
It's
this
more
small.
of a habit.
Oh, so you have a
It's
bad
psychological.
habit of peeing.
Oh my gosh! Are you kidding? Totoo ba yun?
Or a reflex. There's such a reflex.
Oh,
When you take in fluids, later on you
You
will
wanna
feel-
pee right
you wanna
away.
pee.
Oh.
But
How do
not
we correct
necessarily that you have a
that?
lot of
Does it mean that you have your
urine.
bladder is smaller?
Oh, that's a thought.
oh. So oh
That
my
is a
gosh.
thought.
Oh, okay. I used to say, oh, my peanut's the size of a bladder. I mean, my bladder's the size of a peanut. Hindi pala totoo yun.
Basta hindi santol,
Oh,
ha? Nabanggok.
Kasi may bangkok santol. Bangkok santol. Doc, blood and urine pero walang pain. Should we be alarmed?
Yes.
What normally is the
The most
cause?
common cause of blood in the urine,
UTI?
painless.
Painless.
Painless
Okay.
blood in the urine is bladder tumor.
Oh my gosh.
That's why you
Oh,
have to be alarmed.
Okay.
so it's better to have pain when you see
Painful, yeah.
blood, but the likelihood is just might be stones. But if you
Or
don't,
it's just a urinary tract infection.
or a urinary tract infection.
That's
But if it's
really bad.
painless, that's more
More
worrisome.
worries.
Oh my goodness. Okay.
Baliktad.
Oh my. Tonight on Nightlife, it's Clara Benin. If the last name rings a bell.
Yes,
You know,
it does,
right? She's the daughter of
does.
Joey Benin of Side. So she's going to be
Yes.
joining us tonight, Doc Tagle. That means you're just going to have to come back here because, wow, look at us. We had too much fun and it's already 5 o'clock.
I know, so much
Ooh.
faster.
What would be your final message to both men and women when it comes to,
Yeah.
I guess, peeing?
I guess so.
With regards to peeing, either for infection, for stones, or whatever, just take a lot of fluids.
Hydrate.
Lots of fluid.
You have to hydrate.
Baka sabihin, beer na naman.
one quick
2 to 3
question.
liters a day.
2
Just
to 3.
one quick
Dati, 8
question.
glasses lang yan,
The
ah.
one you see in social media that they usually post exercises, pills, drinks, or whatever to help any problems with erectile dysfunction. Are they real or they're faux?
With regards to exercise, they might help,
Okay.
but not that much.
Oh. Because if you see social media, a whole lot of these advertising social media posts about this and drinks and even chocolates and stuff.
So
Sugar.
yeah, please don't believe everything you see on social,
social
media. Doc, how can we get a hold of you? If I'm sure they have more questions. Off air, I
There's
do.
always a next time.
Yeah,
Yes.
I like that. I like that.
Yes, yes.
Oh, and lavender.
Dr. Tessa.
Yeah. Okay.
But
Next
ang
time, what
saya.
color we want?
Oo, lavender
What are we
tayong
wearing?
lahat.
Lavender, yes.
Part 2 of this group. Part 2 of this
Yeah,
group.
sure.
Doc Tessa, thank you so much for joining us.
Oh, thank you
Doc
for
Bong.
having me.
Thank you, Tina.
Thank you again.
Doc Bong,
Thank you, Rylan.
we'd want to remind about the Philippine Medical Association elections on the 15th. It's all digital. So don't forget to vote for all the members of the Philippine Medical Association.
Good luck.
On the 15th, that's Sunday.
This Sunday, it's digital. Please, it'll just take a minute of your time.
Oo, hindi na kayo
for the
lalabas ng bahay.
For the proper administration of the Philippine Medical Association. By the way, I'd like to say hi to the group of Jacob, Jo, Marlon, Seth, and Hayden. They're the group that I had to help with their capstone project. Congratulations to you, and I promise I'll greet them by 5 o'clock.
Oh my gosh, my friend Lee also. Hi, Sheila. Hold on. I want to congratulate her because she is releasing another book. When silence, oh my gosh, when silence wins. Ayan, winning your hurts and battles silently with guilt without engaging. And it's going to be, it's illustrated by my friend Leanne. It was
Oh, okay,
written
that's
by
cool.
Berlin Domingo Mainigo. And it's going to be launched on March 14, 2 to 3 p.m. at Dogan's Book Booth B019. Is that right?
Yep.
If you buy a copy of the book on the launch, you'll get a free bookmark with an artwork by my friend Leanne.
Yes, and of course, hi to the LaSalle Green Hills Alumni Association staff, Ludi and Mar. Mar, happy birthday. And for the board, hello to all of you.
Hang on tight for 5 p.m. OPM.
Magic 89.9.